Hello, everybody. My name is Connor Lynch with Westwood Media Center. Today, we will be speaking with Dr. Robbie Goldstein, one of the candidates running for Congress for Massachusetts 8th District. Dr. Goldstein is currently running against incumbent candidate Stephen Lynch. As a reminder, the state primaries in Massachusetts will be held on September 1st, and Election Day will be on November 3rd. Dr. Goldstein, thank you very much for giving us the time today. We really appreciate it.
Thank you for having me on.
Yeah. So before we jump into the questions, I just wanted to give you a chance to kind of give an opening statement, introduce yourself to people who might not be familiar with who you are, and give us a little bit of a reason on why you want to run.
Perfect. Well, I'll start with the introduction part, which is that I'm Dr. Robbie Goldstein. I'm an infectious disease doctor at Mass General Hospital. And as you said, I'm running to be the next representative for Congress here in the 8th Congressional District. I got into this race back in November with one phrase, one saying about what I was hoping to do, which is to fight for access, equity, and opportunity for every person in every community all across the district. And that has carried us through, that message has carried us through every month as we move towards September 1st. For people who don't know me, I will share a little bit about my background. I actually grew up in a small town. In that town, my dad was a dentist. My mom managed the office. From the day he graduated from dental school, she went to work with him. When my sister and I came along, we went to work too. And we were there after school and on the weekends and all summer long. We were learning from my parents how you care for a community, how you invest in your neighbors. And that work inspires everything that I do now. I came to Massachusetts to go to college nearly 20 years ago, and I stayed. I never left. I stayed to get my MD and my PhD. I stayed at Mass General to do my training in internal medicine and infectious diseases. And throughout it all, I knew that what I wanted to do was exactly what my parents did. I wanted to care for communities, and in particular, those that were most left out. And so I became a primary care doc, and I largely cared for folks living with HIV, people in the Lgbtq community, and people affected by substance use. That work over the past 10 years of building the practice is what has inspired this run for Congress. It's the stories of all of my patients, hearing from them about the challenges they face. We certainly talk about healthcare access and insurance, but more often we talk about food security and housing stability and jobs and transportation and racial justice, issues that I think require a fresh perspective in Washington. And so I got into this race to make sure that that fresh perspective is there and that there's a representative in Washington that shares the values of people across the district and leads with those values every single day.
Absolutely. And I think that you have also offered a little bit of a unique perspective, obviously, in these times. I don't want to really hammer home the point of coronavirus, but obviously, as an infectious disease doctor, you certainly will give something that is a much more unique perspective than I think a lot of other candidates have been able to offer. And not just candidates, but also currently sitting congressmen as well.
Yes, yeah. I mean, I'll share that I'm the only infectious disease doctor running for Congress in 2020. There are none in Washington, and there have never actually been any infectious disease doctors. I think it is a really unique opportunity to elect someone with an expertise and a skill set that can help us through this pandemic.
Absolutely. I want to ask because I want to make sure that people understand exactly what you see your role as being. So, can you describe what you think the role of a congressman is supposed to be?
So a congressperson should be a representation of the district. It should be somebody who listens to the voices all across the district. That includes in the 8th district, folks down in Brockton from the Haitian community or the Cape Verdean community, folks in Situate and Hull who are facing climate change and the immediate impact of the rising tides, folks in Dedham and Westwood who are dealing with transportation concerns. It's listening to all of those people and making sure that those voices are heard on the floor of the House. I think it's really important for a congressperson to continue that two-way communication because it's the only way that the congressperson can truly represent the district.
Excellent. I want to also ask because we're obviously in 2020, which has been a bit of a hectic year. These campaigns that have been going on have been very different. Obviously, we're doing this interview through Zoom and everything like that. Can you tell us a little bit about how the coronavirus has impacted your ability to reach viewers and or viewers, voters, what have you, and also how you can see that impacting your work as a congressperson if you were to be elected?
I'm not going to lie, this has been a crazy campaign in many ways, right? I mean, who would have expected when I launched in November that almost all of our campaigning would happen over Zoom and phone calls instead of standing at the door and talking to people? Uh, We did start in November with a very clear idea of how we were going to build support for this campaign, and that was through relational organizing, through talking with community members and having them share with their neighbors, their family, their friends about this campaign and building person by person a movement across the district. And while COVID definitely changed that experience, right, we do that still. We do that through Zoom calls where we do virtual meet and greets. We do that through phone calls where we do some relational organizing or text messages where we're having folks text their friends. The idea of how we are going to get the word out is still the same. COVID has changed a lot in campaigns, in some for the better, and I think it has in many ways changed government in some ways for the better. It has made it so that government officials have to be accessible. We are very comfortable using Zoom. We're very comfortable doing town halls and forums over these virtual formats, right? Now
Mhm.
there's really no excuse, no reason why a representative who maybe needs to be in Washington for a very important vote can't also connect with folks back home in a very intimate setting. Sometimes Zoom can be that intimate setting. I think we're going to learn a lot about campaigns in this election cycle. I think we're going to learn a lot about how you govern and how you make sure people feel connected when you have to be physically distant from other people. I'm hopeful that the work that we've done in this campaign will really pay off and people will see that you can still do relational organizing, person to person contact, even in a safe distance to prevent the spread of COVID.
Absolutely. And I think it also can speak to a little bit more of open transparency because there's more accessibility to candidates, more accessibility to public figures where they now have more opportunities. I mean, not saying that we didn't have these before, but because we become more reliant on them, we might be more used to using them. So I think that, again, as you say, in the next couple of months, this election cycle has kind of clearly put things on ice, but you can kind of envision how things are going to go forward and a lot more transparency and openness with candidates, which I think is one benefit to come out of a very tough situation.
Yes. And I kind of like that we get to see everyone's homes. All these Zoom
Yeah.
calls you get to sort of see, right? You get that window into people's lives. You get to see what they have on their walls. We'll say I'm in an office.
Yeah.
Inside my apartment, we kind of turned a bedroom into an office so that we can have this backdrop. But I think it's pretty amazing that we get that intimate feel of who our representatives are.
Absolutely. So, taking a step back from coronavirus for a second, because I want to address the education system. And right now, the first, second, third, 12th concern is obviously going to be opening up and adopting some type of model in the fall for schools. But if we were to take that and put it aside for just a second, what do you think would be the most important thing that's facing our education system, and how do you believe that that can be fixed?
It's hard to set aside COVID because it's such a big issue for education, but I really think it comes down to equity. It comes down to equity and access in our education system. There is an enormous racial gap that exists in our education system right now. And it is a gap that is perpetuated by the current policies and widens as students go through the public education system. It starts before folks get to public education. It starts because we don't yet in this country have universal access to pre-K and childcare. And that disproportionately holds back children of color, Black and brown kids whose parents may not have the financial means or may not have the resources to have their kids in pre-K. We've got to guarantee that pre-K education so that everyone can start kindergarten on a level playing field. That will start to close the gap. We have to think about what's happening in our schools and the racism that exists in our schools and our public education system, and how do we make sure that the curriculum that are taught that they are anti-racist and they are not pushing Black and brown kids down while lifting white students up. We have to think about what resources are available in our schools, from school counselors to after school programs, and how that may help close that racial gap. And it could persist, it continues as folks go through K through 12 and go to college, right? Where we know that the college education system is really set up in a way that holds back Black and brown students. Student loan debt, the ability to afford college, weighs heavily on Black and brown students. So that concept of equity is present at every step of our education system. And we've got to address it at every step to begin to narrow the gap that exists.
What would you say is your plan of attack, to shift gears a little bit, to take on and address the unemployment that happens within the district?
Well, there are two sides to the unemployment concerns, right? There is what was already existing before COVID-19, and then there's the exaggeration of the concern since COVID-19, right? With millions of Americans losing their job and millions of Americans filing for unemployment. And we've got to address what's happening in COVID-19. We've got to get people back to work. There are a lot of ideas of how we can do that. The CARES Act and the HEROES Act were band-aids in some ways to make sure that people had access to unemployment benefits. But we got to think about how are we going to actually get these people the jobs that they need. I think we can marry that with a little bit of how we solve the broader unemployment crisis that does exist in this country. Now, we can do that by investing in the right space. And in particular, in the 8th District, I think there's a huge opportunity here. There's an opportunity to invest in the green economy. There's an opportunity to invest in adaptation projects and efficiency projects all across the district, making sure that the infrastructure along the South Shore is ready to withstand the rising tides, making sure that the roads and buildings in Brockton can tolerate the rising temperatures, making sure that the affordable housing that exists in Boston and Brockton and Quincy is highly efficient and makes us less dependent on fossil fuels. But I also think there are other ways that we can invest specifically in the 8th District. And one that I talk about often is how do we build up the jobs that exist in and around Brockton? Brockton has a lot of really unique opportunities. It has 3 hospitals there. It has a really energized and engaged workforce that has been in healthcare before, oftentimes taking transportation to Boston or to other places to work in healthcare. We could build up a biotechnology, a biopharma corridor going down to Brockton that would help us with the unemployment, would make sure that Brockton has the resources it needs to be a highly successful city, would move Brockton into a higher level, right? And I think those are the types of investments that we have to make. They are going to think about equity, right? And it's going to think about who's living in Brockton, the Cape Verdean community, the Haitian community. How do we get those people the jobs that pay them the wages that they need? It's going to think about the future of the district in Massachusetts and how we invest there. I think it's going to be a win-win all around.
I think all that's really poignant. I think that's all very important. And I want to take a step back because we were going to address this question a little bit later, but I do want to bring it up that you brought up in terms of solving a little bit of the unemployment problem, a lot more things that were related to climate change, especially as you mentioned, going down on the South Shore to make sure that they're okay with rising tides and whatnot. So I do want to take this question a little bit out of order and ask you, what do you think is a sensible action plan in regard to climate change? And as we've been talking about, the Green New Deal and whatnot has been a huge topic, especially on the federal level. How do you see that plan or other plans? How do you think they've been in terms of their success?
Mhm. So I'll start by saying that I see climate change as an urgent crisis. I see our changing climate as really the fight of right now. Certainly, we have to deal with COVID-19, but we also have to deal with how the climate impacted folks when it comes to COVID-19, how those people that are living in communities with higher levels of air pollution are also the communities that have the higher rates of COVID-19 infection. So this is an urgent crisis. We've got to deal with it right now. We don't have 40 to 50 years to wait. The Green New Deal is an amazing package of resolutions, a concept of how do we move ourselves into a green economy? How do we really decrease our dependence on fossil fuels and make sure that we're more efficient? One of the things that I really like about the Green New Deal is that it does have that very specific focus on changing our dependence from fossil fuels to renewable energy sources. One of the other things I like about the Green New Deal is that it recognizes that that's not enough. We've got to do a bunch of other things. One piece is what I talked about before, which is that adaptation piece, recognizing that no matter what we do today or tomorrow, even if we fixed all of our problems and we moved into a completely renewable energy space, we will still have 1 to 2 meters of sea level rise. We will still have increases in global temperatures in the next 30 to 50 years. We've got to be prepared for that. And the adaptation work is incredibly important everywhere, but I stress it here in this district because this is a district with a lot of the coast along the South Shore of Massachusetts. It's a district that has, tremendous heat disparities when it comes to the cities because of how things have changed and the way that things are built. We have to invest in the adaptation side. And then the final thing I'll say about the Green New Deal is that the package of the Green New Deal specifically calls out and says, you can't talk about climate change if you don't also talk about healthcare, and if you don't also talk about transportation, and if you don't also talk about racial equity. And that idea, that concept is what I think makes the Green New Deal have the highest potential for success, because it is not just singularly focused on going from fossil fuels to renewable energy, but it's going to from fossil fuels to renewable energy that will benefit communities of color, that will change the way we use our transportation system, that will build the right jobs and build up our economy in the right way. It is this broad view of how we can fix this very, very urgent crisis we're facing.
And I think it's important that you know that the Green New Deal is not just tackling environmental concerns, but it's also kind of, as you said, piecemealing a bunch of different problems that can be addressed slowly but surely together. And I think it's also important to stress that what it sounds like you're saying, and I don't want to put words into your mouth, but essentially that there are some inevitabilities that are going to come with climate change. And so it might be impossible to fix every single issue. It's more figuring out how we can adapt to those issues coming forward. And I think that that's a big thing that people want to know going forward, is how things can be tackled, in what order, in what way. So plans that you have and plans that you support are going to be a lot more broad spectrum and trying to bring in a lot of different things into that fold.
Yeah. I oftentimes say, right, we have to do both. We have to do two things. We have to manage the unavoidable, right? So that is the shift to fossil fuels and the increase in our efficiency so that we can slow the rise in temperatures and we can slow the rise in the seashore. But we have to do the reverse, right? We have to sort of manage the unavoidable. We have to make sure that we recognize there's going to be these changes and we're going to have to manage them. That's adaptation. That is making sure that we're prepared for what's going to happen, because it will happen. We have gotten ourselves to the point of no return in some ways for certain aspects of the climate.
I want to address the opioid crisis a little bit because this has been something that has been going on for years. This is not a new topic of conversation. Many different communities, not just with the 8th District, but just all around in Massachusetts especially, it has become a widespread issue. Could you give us a brief summary about what is happening right now to combat that opioid crisis and what you think can be done to better combat it?
So, we heard just this morning that Brockton is losing a whole series of beds for addiction treatment, for inpatient addiction treatment. That's what's happening now. Places are closing. Evidence-based harm reduction strategies are being shut down because we don't have the funding, we don't have the support in the setting of COVID-19. We have to do better when it comes to the opioid epidemic. I'll tell you, as a physician, as someone who sees people living and affected by substance use disorder, this is very real to me. I know when my patients come to me and say, I can't find a bed in a treatment center, I can't figure out an outpatient treatment program that will take my insurance, that I can afford, that will provide me the care. I sit with my patients and struggle with them, trying to figure out how we can get them the support that they need. We also, though, I think have to remember that Massachusetts has done a lot of great work here. Massachusetts has, in some ways, led the charge when it comes to harm reduction. Massachusetts has led the charge with needle exchange programs, with moving forward with methadone and Suboxone prescriptions, with talking about mental health services, with getting vans out on the street so that people can be treated where they are, met where they are when it comes to substance use, making sure that we have recovery coaches and community health workers that are involved in this process, pushing forward, although not yet passed, with safe consumption sites and sites where people can go to get the care that they need. We've got to use that experience in Massachusetts and look at the evidence that we've created for success here in Massachusetts to spread it across the country, to recognize that the opioid epidemic affects all 50 states. It affects every city, it affects every town, it affects every community. We've got to make sure that what works expands to everyone else.
I'm wondering if you can talk a little bit about with the pandemic, with the opioid pandemic, if you can just a little bit about what you might see as kind of normalizing the conversation, because I think recently there has been a lot more people who can say, yeah, I've known somebody who's been affected by it. I know somebody who has succumbed to it, or I know somebody who has grown away from the addiction. I'm wondering if you can talk a little bit about, is that a good method to go down, of kind of like normalizing the conversation, saying, yeah, there's needle pickups in the police station and the fire station, that people can do this safely. You're talking about safe injection sites. Is that something that kind of factors into that? Or is that something that you think would need to be a little bit more avoided?
No, I think that's a huge piece of what we're talking about. It is getting rid of stigma. I've spent a lot of time in my medical career talking about stigma, because almost every community that I work with faces stigmatization, marginalization. And the best way to combat stigma is to really put things out there in the open and normalize things, right? And say it's substance use disorder. This is addiction is a condition that can be treated medically. This is not about using old terminology like substance abuse or addicts, or things that are scary and further stigmatize people. This is about recognizing that if someone walked into my clinic with diabetes and needed insulin, I would not stigmatize that person. I would provide them a medication that I know can make them better. When someone walks into my clinic with substance use disorder, I know that I can provide them a medication like Suboxone. I can get them referred for methadone. I can decrease the stigma by just saying, yeah, I can, this is a medical concern. I can treat that medically. We're going to support you through this. And there is no shame in substance use disorder. That's going to take a lot of work, right? We have decades and decades of stigmatization that we're combating, but it's really, really important for us to do that work every single day. I oftentimes say on the campaign a lot, words really matter. And so it matters to me that people say things like substance use disorder, and that we talk about it in a very specific way to make sure that it's clear that I am not furthering stigmatization in any way. I'm not furthering that marginalization in any way.
And I think that's important not only for the people who are suffering from it, but also people who are just hearing from it. So I think it's important that everybody kind of gets familiar with it and kind of just feels like it's a topic of conversation that just need to come up, because it's absolutely a huge issue. So shifting gears just a little bit, especially lately, but kind of in a general sense, a big population that kind of gets a little bit neglected is the senior population. And especially with the pandemic, seniors rely, especially in Westwood, on the Council on Aging for a lot of their programs, and our senior centers have had to shift a lot of their programming and whatnot. I'm wondering if you can talk a little bit about different ways that people might be able to assist our senior population just a bit further to make them more comfortable and make sure that they're being cared for in these times.
Certainly in COVID, seniors are facing infection, they're facing high risk, they're facing isolation, right? Because they know they're high risk, and their family and their friends aren't coming to visit them. They can't go out and socialize, and we've got to do whatever we can now. But there's a lot of other work that needs to be done even after COVID, or if we pass through this pandemic. Uh, you know, uh, Social Security and Medicare are incredibly important to our seniors, and there are constant threats to both of those programs coming out of the federal government, coming out of President Trump. Right, we've got to stand up strong and say this is, in many ways, how most seniors in this country survive. They survive because they have Social Security to help pay their bills. They survive because they have Medicare that should be able to provide them all of the care that they need. We've got to build on both of those programs, but I think in particular Medicare, and make sure that Medicare does provide the care that people need, that people can be healthy and well at home, and that we aren't sort of shifting people into hospitalized settings or institutional settings or facilities where they may actually be at higher risk. A lot of people are much better off in their own home. But then for those people who aren't safe at home, for those people who need those resources that we as a community, as a society, are providing for them, this is, I think, going to be a broad partnership between the federal government, the state governments, municipal governments, and community organizations. But it's going to take the federal government with some heavy investment to make sure that our seniors feel safe and secure. Um, that should be part of what we're thinking about in stimulus packages and relief packages coming out of COVID-19. How do we build up that support for our seniors? And then we've got to make sure we institutionalize it and keep it moving forward beyond COVID.
So recently, and you kind of touched upon this in your opening statement, we've seen a great deal of conversations surrounding LGBTQ rights. both on a federal level and state level, in the workplace and whatnot. So I'm wondering if you can talk a little bit about what your policies are concerning LGBTQ protections, and also if you can talk a little bit about how you want to handle LGBTQ youth, because I think that's been an even more prevalent conversation in the last couple of years.
Let's just look at what's happened over the past few months, right? We had a Friday afternoon when the Trump administration released a ruling from the Department of Health and Human Services basically saying that our healthcare system does not need to provide benefits to the LGBTQ community, that healthcare providers could discriminate against LGBTQ folks. And the following Monday, the Supreme Court said there can be no discrimination based on sexual orientation and gender identity in employment. And we are living in a world now where those two rules exist, where you can have a job and can't be discriminated in receiving that job. But once you have the job, you might not be able to have health insurance because you can't have discrimination in your health insurance. Now, that is holding the LGBTQ community back. That is a horrible tension for people to be in. I'll tell you, it is a tension that my patients talk to me about every single day since those decisions. Can tell you the number of phone calls and emails and messages I've received about those concerns. And what we have to do is legislate the answer. We have to make sure that it is incredibly clear that in this country, there can be no discrimination based on sexual orientation and gender identity, no matter what the issue is: healthcare, employment, housing. It doesn't matter. We will make sure that LGBTQ folks are protected and equally protected with everybody else. This is an enormous problem across the age spectrum. I will call out that it's a huge issue for older LGBTQ folks who oftentimes are living alone, who maybe don't have the family support that other elderly individuals may have, and are facing issues of discrimination when it comes to healthcare and housing and maybe employment if they need it. But you brought up LGBTQ youth, and I can't, as somebody who is a gay man, as somebody who cares for the LGBTQ population, as someone who specifically cares for the transgender population, you can't not recognize the disproportionate impact of mental illness on LGBTQ youth, the number of folks who commit suicide, attempt suicide in the LGBTQ population. The numbers are shocking. And there is a very simple fix. We actually know the fix. The data are there to show us that when LGBTQ youth are affirmed, when they are affirmed by their school, when they are affirmed by their parents, when they are affirmed by their community, they are dramatically less likely to attempt suicide, to have issues with depression or anxiety, to be homeless, to drop out of high school, right? So much of their lives improves simply through the affirmation and welcoming of government, family, society. So we need to work on that on the government side. That's the role of a congressperson, right? Is to ensure that welcoming, affirming environment. We've also got to work on that on a societal side to make sure that the rest of society is affirming folks. This is the work that I do in the hospital. This is the work that the healthcare institutions have to do as well to make sure that people feel affirmed when they come in for their appointments.
And I think that's a very poignant and a very important thing that you emphasize, that it's much more important to kind of normalize that kind of conversation. I know I used that phrase before, but it's apt, because the sooner that people can get more comfortable with the idea, the sooner that people can feel as though these things, especially in the youth, especially in schools, that they can talk about these conversations, the easier it's going to be for people not only to feel comfortable coming out, but also to feel comfortable being in those workspace environments as themselves, because I think a lot of people are afraid to do that. And I think it's important, as you said, to kind of make sure that as a societal institution, we continue to let that conversation be just a little bit more, a lot more generalized and a lot more accepting.
Yeah. I mean, if you'll let me, I'll just say one thing
Please.
about stigma here, right? I mean, what does stigma do to the LGBTQ community? It results in Black and brown gay men and bisexual men having incredibly high rates of HIV because they feel stigmatized by the medical community, they feel stigmatized by their society, they don't access HIV prevention services, they don't have access to pre-exposure prophylaxis, a very evidence-based, widely prescribed medication, but the medication is being prescribed to white gay and bisexual men and not to black gay and bisexual men. And that stigma that exists within the LGBTQ community has resulted in an ongoing epidemic of HIV across this country. Right? We can fix that. We can. We just have to make sure that we, as you say, normalize this conversation, take stigma out of the conversation, take marginalization out of the conversation, and make sure that people feel welcomed.
Absolutely. My final specific question is kind of tying into a lot of the different things that you've talked about throughout this entire interview, which I think is very important for a lot of viewers. We've seen in, again, 2020 being the year that it is, that we've seen a lot more protests, especially with the Black Lives Matter movement, and very specifically the protests that have come out of the murder of George Floyd. So I'm wondering if you can talk a little bit about what you think would be some of, or the most important thing that can come out of these protests that can really affect our entire nation.
I think we've already seen a lot of great work that has come out of these conversations we're having, the protests, the rallies, the vigils, all of the events that are happening after the death of George Floyd. Some of that is legislative work that has come out of the House already. The George Floyd Justice and Policing Act, I think, was an amazing step forward. But I also think it was really the sort of bare minimum of what we have to do from the federal government. We've got to keep pushing forward. First, that's got to get passed by the Senate. But also, we've got to make sure that there are very, very clear and explicit legislative packages around ending qualified immunity. We've got to make sure that we are providing medical care to those that are being detained, so that someone like George Floyd, who says, I can't breathe, someone who says, I need help, someone who says, I'm hurt, can actually access medical care, and that that is mandated by the federal government. We've got to make sure that we are addressing racism in police departments through oversight all across the country. But I oftentimes will say that it's not enough for us to fix what is happening in police departments across the country. It's not enough to simply think that if we pass these laws and put more oversight over police, that we're going to eliminate the racism that exists in the criminal legal system. We have to remember that those police officers were educated in our public education system. They grew up in the housing system that exists in this country. They grew up in the racist society that has existed for the past 400 years. And so until we are very intentional and explicit with our anti-racism policies in every aspect, infrastructure, housing, education, you name it, we will never be able to get rid of the racism that exists in the criminal legal system. So we have a lot of work to do. But what makes me hopeful is that the conversation has changed. It's changed from, I don't see the problem, which is what oftentimes was said before George Floyd, to, oh, there is a problem and we now must fix it, right? So now we get to do the work of figuring out the right solutions to the problem rather than fighting about whether or not a problem actually exists.
And I think, we've seen a lot more communities take this a lot more seriously. We've seen different statements and things come out, but even in Westwood, there was a conversation that was held with our police chief and our town administrator, kind of going over, I believe the topic of conversation was racial justice and policing. And I think that, again, as you said, those conversations are important. And even if it is just getting the word out and letting people talk about, acknowledging that this is not just something that goes on the wayside and is not prevalent to everybody, because everybody can have a hand in it. Everybody can help kind of fix it a little bit more. And I think that even at the smallest step, just having that conversation of, as you said, this is a problem, is going to help really, I don't want to keep saying the word normalize, but it's true. It's getting people more comfortable with the idea that they need to acknowledge that these problems exist.
Yes, yes, absolutely.
So before we wrap up today, I did want to give you a chance to talk about, is there any specific topic or thing? I know you have a number of different policies. I know we can't tackle everything within a short time frame, but is there one thing that you think we want to emphasize on that I didn't have a chance to ask you today?
I think if you allow me, I'll talk about two, but they're very related,
Sure.
which is healthcare and reproductive justice, right? And I think that we are at a moment in our country where we need to have a very robust conversation about where we go with healthcare in this country and how we protect people's access to that healthcare. That includes a woman's right to choose, that includes access to reproductive services, that includes healthcare and reproductive healthcare that recognizes the racial disparities that exist in the healthcare institution. And you know, I come from the system. I come from within the broken healthcare system. I know what is broken. I know what my patients tell me about every day and the challenges that they face. I know the challenges that I face as a physician, trying to make sure that people can get their medications, that they can access reproductive care. I think it is time for us to have that conversation, to move ourselves into a place where healthcare is a human right and not a benefit for people who can pay for it, that we actually universalize healthcare through a Medicare for all or a single payer system, and for us to move into a system where we actually legislatively make sure that Roe v. Wade is the law of the land, that women have a right to choose how and when and where to have a family in this country, but more importantly, that they have the right to access healthcare anywhere in this country that is affirming of who they are and their own choices.
Excellent. Before we kind of wrap up the program, I do want to give you a bit of a closing statement. Tell us a little about who you are, tell us why you are running, and tell us why people should vote for you.
Well, first I'll say thank you for having me on and for the conversation. I actually think this was a really wonderful conversation about issues that matter to folks in this district and matter all across the country. You know, I'll reiterate a little bit about what I said at the beginning, which is that I'm running because I really feel that this district deserves representation that shares its values. I think it deserves a fresh perspective. You know, as I said, I think it's time for a fresh perspective on healthcare. I think it's time for us to have a perspective that is based in the truth that healthcare is a human right. I think it's time for a fresh perspective on equality that asserts the importance of a woman's right to choose, that will bring justice into the criminal legal system, that can recognize race and ethnicity and sexual orientation and gender identity, and how they all compound in so many ways to impact people's access to jobs and transportation and education and certainly to healthcare. But I think fundamentally I've gotten to the race because I think it's time for us to have a fresh perspective on the role of government, one that is not afraid of bold leadership and big structural change to address all of these challenges that we're talking about and more, right? Gun violence, the racial injustice that we talked about, the COVID-19 pandemic that we're living through, climate change. There are so many challenges and they're going to require bold solutions. So I am excited about the rest of this race and looking forward to continuing this conversation. For those people that are watching, I would ask that you vote for me in the September 1st primary. It's on or before September 1st, given the way that voting is happening this year. And I will say the thing that I say at the end of almost every conversation I have, which is this is really the start of a conversation. And I welcome an ongoing conversation with you and with all of the people who are watching right now.
Well, that's wonderful, and I hope that the conversation can continue. I wish you very much luck, and I really appreciate the time. It was a pleasure to talk to you, to get to know you a little bit more, and I hope that people have a much better perspective on who you are and are a lot more informed when they go to vote on or before September 1st. As a reminder, the state primaries will be held on September 1st, and the elections will be held on November 3rd. My name has been Connor Lynch with Westwood Media Center. Thank you for watching.